as concerns grow over the country's readiness to handle a potential outbreak of the M-pox virus. Allocation of resources to aid in the awareness and readiness to deal with M-pox has been cited as a major gap at a time when the disease has been declared a public health concern. And Odida with more details on this report.
Health workers who will be the first responders in such an event are increasingly worried about their lack of preparation, training and essential resources needed to combat the spread of the virus.
There is no preparedness in our hospital in terms of any infection on how to handle it. If there is a massive infection in the country, we may not be able.
In a recent interview, the Secretary General of the Kenya Union of Clinical Officers, KUCO, emphasized that much more needs to be done to ensure the country is adequately prepared for any potential M-pox cases. He pointed out that many healthcare workers have not been sensitized or trained on how to manage the virus, which could have serious implications if an outbreak were to occur.
There could be some communication for the officers along the borders, or rather the entry point, in terms of what they are doing. But we know very well that we talk to our people. The healthcare workers are not still sensitized about this case.
This lack of preparation is not limited to training alone. There is a growing concern about the absence of vaccines, which are crucial in controlling the spread of M-pox. Health workers fear that without vaccines, even the most prepared medical teams will struggle to contain the virus.
If indeed the disease persists, we need to see how to initiate a process of ensuring that there is vaccine to vaccinate our people and protect our community.
Adding to the anxiety is the reliance on international aid for vaccine supplies. Emergent Biosolutions, a global life science company, recently offered to donate 50,000 vaccines to African countries that are on high alert for M-pox. While this offer is seen as a positive step, it also highlights the region's dependency on external support to manage health crises.
Ensure that at least our laboratories are enabled to ensure that we can get diagnosis whenever I need them. Because we know that like when we had COVID, the centers for diagnosis were limited until we had to increase the capacity so that we can enable every region to do that.
And as the situation remains uncertain, there is a clear call to action for the government and health authorities to ensure that healthcare workers are adequately trained and vaccines are made available. So far, Kenya has reported only one case, with 10 suspected samples still in the laboratory for testing. Anna Odida, TV 47.